PEPFAR, saving lives, investing in people. PEPFAR, partnering for an AIDS-free generation.
There are estimated to be more than 350,000 traditional health practitioners in South Africa. That's almost 9 times the number of medical doctors, making them more accessible to the population.
80% of the population uses the traditional medicine. The traditional practitioners, they live with the people, so their access is much easier than going to the health facilities.
At the beginning, PEPFAR was just a monster of the scientists who were coming into our country to come and steal our knowledge. The Western healthcare system was not planned to work with traditional healers.
Programs around treatment, HIV awareness, tended to focus largely on the biomedical community, the doctors, nurses, pharmacists.
When the HIV/AIDS pandemic started, the major challenge that we're facing as traditional healers is that people were not accepting it.
The partnership between traditional leaders, traditional healers, the CDC, and PEPFAR has saved many lives. This 5-year cutting-edge project focused on local-level collaboration between clinics and traditional healers.
PEPFAR came in to assist to get the traditional healers as well as the Western healthcare system to work together.
We had an opportune moment when we got funding through PEPFAR to improve the relationship of a referral between the two systems. In terms of strengthening the primary healthcare system, that's very important.
This partnership became a true model that will contribute to the development of traditional healthcare knowledge without compromising intellectual property rights of the healers.
In our African culture, if somebody is sick, we believe that that sickness is caused by something else. It can be caused by the ancestors. It can be caused by the neighbors, the friends.
We're getting media reports that traditional healers were spreading myths about HIV/AIDS. We recorded traditional healers on their own voices saying, this is a myth themselves with a face. You cannot sleep with a virgin to get rid of HIV, which was very powerful.
We started the training to educate the traditional healers about the virus itself so that they understand the virus. They understand the symptoms of the person who is HIV positive. It is difficult for us to diagnose HIV positive. If you suspect then this patient is HIV positive, then refer that patient. It's either to the clinic or to the hospital.
When we got the traditional healers to work with us around HIV and AIDS, for them to work with us in a clinic and for them to be able to do the testing and counseling, to explain to people that they have to take their medication, and very important of all, to tell people that when you come to me, we'll be working on psychosocial issues and I'll be blessing the medication, but we can't mix our medicine and Western medicine until we know where you are and that you're getting better.
Traditional healers have an oral tradition. They don't record things in writing. And so the program had to find tools that are appropriate to their practice. So we developed tools that are pictorial in Zulu, but they may be appropriate for the healthcare centers to understand what is happening. They encourage people to go and test for HIV themselves, and the community believes in them. They trust in them.
Traditional medicine represents the first line of care for the majority of people in sub-Saharan Africa. For this reason, the role of traditional healers in healthcare service delivery in South Africa is of national importance.
We didn't want to see any PEPFAR when we started this project because because of the history. But now as time goes on, as this HIV was getting into our veins, we started to understand HIV. That is when we say, no, we need more of the PEPFARs.
PEPFAR, partnering for an AIDS-free generation.